This is Tracy Hartman, and I'm here with WMWSJR with today's latest, hottest health topics. We're here today at the County General, and we're going to tell you about the latest superbug, a new nosocomial infection called Clostridium Difficile. Earlier this morning, when I was doing some research, I found an article written in the late 1893s about a girl who was 22 years old, and she had an intestinal tumor that she had surgically removed. Within 15 days of her surgery, she was dead. She had developed severe diarrhea, progressively got worse, and they could not figure out what was wrong. Later, during the autopsy, they found that she had Pseudomonas lesions, which we now know to be an overgrowth of Clostridium Difficile in the small intestines. Later, in the early 50s, doctors started to notice this happening more and more often, and they couldn't figure out what was going on. They finally decided that it was an overusage of antibiotics. After doing some research, they finally thought that it was Staphylococcus aureus causing this problem, which we now associate with MRSA, which is another nosocomial infection running around rampant in the hospitals. By the 60s, there were more tests done, and we finally figured out that it was a Clostridium Difficile that was causing the problem. Clostridium Difficile is a gram-positive spore-forming bacillus. It produces A and B exotoxins and is transferred from patient to patient by spores that are getting on the patients, and then the nurses are spreading it from one patient to the other. What are the symptoms, you ask? Well, it's severe fever, vomiting, diarrhea, loss of appetite, pain and tenderness in the stomach. We've learned that it is very resistant to antibiotics, and we are now treating it with one antibiotic called vancomycin. This is a very strong antibiotic, and it is looking like it's getting rid of our C. diff problem. However, our nurses need to work really hard to make sure that they keep their hands clean and wear the proper equipment when they're doing their work on their patients. We have done a reenactment, which we will show you now, of a nurse not doing this the right way. Hi, Miss Noble. My name is Angel, and I'm going to be your nurse for the day. I just need to listen to your heart real quick.
So sweet.
Thank you. Okay, Miss Noble, I'll be back in to see you in just a few minutes, okay?
All right.
Hi, my name is Angel, and I'm going to be your nurse today, and I'm just gonna listen to your heart for a minute and listen to your lungs. Okay. Breathe deep for me. Everything sounds good. I'll be right back, okay?
Okay, thank you.
As you can see, this nurse waited on one patient, and all of those spores just jumped right on her. And then, as she went to see the other patient, she didn't bother washing her hands or anything. And all of those spores fell on the next patient. This is scary, people. This is going to continue happening if we don't do anything about it. We have to work harder. We have to wear our gloves. We have to wear our gowns to make sure that we don't pass this on to our patients. This next reenactment will show you how things should really be done. I'm sorry, I didn't mean to scare you. I just need to listen to your lungs and your heart real quick.
When you get a chance, will you tell the CNA I left her a surprise underneath the covers?
I'll let her know.
It's a nasty one.
Are you okay?
Yeah, it's just a big one, you know what I mean?
All right, well, I will send her right in, okay?
Okay, thanks.
Corey, hi, I'm Nurse Angel. I just need to listen to your heart real quick and your lungs. Okay, everything sounds good. I'll be back in a little bit. Thank you. Thanks for watching. This is Tracy Hartman with WMWSJR, bringing you today's latest, greatest, hottest health topics. Thanks.